The ASCRS Foundation delivers humanitarian eye care to those most in need in the United States and abroad. Operation Sight is the Foundation's US-based charitable cataract surgery program, serving eligible uninsured and underinsured Americans. The program is fueled by the volunteerism of ASCRS members and charitable organizations who are committed to making cataract care accessible in their local communities. Since 2014, the program has provided almost 6,000 cataract surgeries to patients in need. I'm Jaya Minhas, Operation Sight's Program Manager, and I'm excited to feature some of these volunteers who make these life-changing surgeries possible. In these volunteer spotlight conversations, we'll learn more about the pressing need, the impact of local volunteerism, and the rewards to patients, surgeons, and staff. Welcome to a volunteer spotlight conversation with Operation Sight icon Dr. Donahoe at St. Louis Mission Cataract. Thank you for your time today. I would really like to get started to learn a little bit more about how you first got involved with Operation Sight and just about your great work that you do at St. Louis Mission Cataract.
Sure. Thanks for having me, Jaya. I started the St. Louis Mission Cataract program back in 2013. I was around that time, I was thinking and wanting to do mission work. I'd been in practice for 20 years and thought it was time to start giving back. And I always thought I needed to maybe go to Mexico or overseas, but I realized as we saw patients in our office without insurance that came in need of cataract surgery, that there was a need right in my backyard. So we started the St. Louis Mission Cataract program in 2013. And to date, we've done well over 500 free cataract surgeries.
Wow, that's incredible.
It was probably 3 years ago that I found out about the ASCRS Foundation and their program. So we kind of joined hands and united with ASCRS, and they've been a great help in funneling patients towards us and also in supporting the program, so we're able to continue.
I know that charitable cataract surgery and just making cataract care has been accessible has been very important to you for a very long time. I know last weekend was an important day of kind of making cataract care accessible in your local community. Can you share a little bit more information about that event?
Yes, of course. So we did our Saturday surgery day. We did close to 20 patients on Saturday. We have our surgery center staff. I had 4 surgeons that volunteered their time that are kind of part of our group. And like I said, we did about 20 cataract surgeries. And it's just amazing the volunteerism that comes together. We have our nurses from the surgery center that will volunteer. They bring their kids in to help, roll patients in and out, clean beds, do all the things that need to be done to make sure we run a smooth program and have a smooth surgery day. So yes, we do the program usually twice a year. So usually we have a surgery day in the spring and in the fall, and we accumulate patients, kind of in between the programs. We bring them in about a month before surgery to have their exams by the doctors, and I'm involved with most, if not all, the exams and doing all their measurements for surgery. And that's another nice volunteer day for my office and the people that work in my office, my staff.
It's really inspirational and just impressive that you have such a volunteer presence on the weekend too. I know when we've spoken in the past, you've really shared that there's high morale on the Saturday events where volunteers just want to give back on a select day of giving. In terms of just that day and seeing the patient need and speaking with patients, were you able to learn a lot more about just how important a day of charitable cataract surgeries is for them?
Oh, it's life-changing for them. And, especially recently with the pandemic and job losses and insurance loss for people, there's no doubt that there's a lot of need out there. And I tell you, the gratification that we get in doing the surgery is amazing. I had a couple patients in tears after their surgery. Most of these cases are so advanced. We did probably half of our cases were mature cataracts. So these people were at best being able to count fingers, and that's it, not even be able to see the 2400 big E. So they notice an immediate improvement right after surgery, which can be very emotional for the patient. So that kind of feedback, immediate feedback, is what we thrive on, and what all the volunteers thrive on. I mean, some of my volunteers were very moved actually by some of the patients afterwards, by how they reacted to being able to see almost immediately.
I can imagine, and that's so inspiring. I think it's important that you mention, the COVID pandemic, and the effects that that's had really on patient populations. I think Operation Sight, we're reaching more and more patients that are experiencing homelessness, and unemployment, and really have no other means of getting their eyesight restored without programs like Operation Sight, and volunteers like you at St. Louis Mission Cataract that's able to make it possible. I think it's an incredibly emotional experience, something like you were saying, very instantaneous, for a patient to go in almost completely blind, and fearful that they'll never have their sight back, and to walk out being able to see is just really incredible.
Right, right. So I wanted to add, Jaya, that we last year during the pandemic, we did not do our Saturday programs. We just kind of sprinkled in the cases to the different surgeons that wanted to participate in the program, and they just put them in their regular surgery days. But I got feedback from the staff at the surgery center that said, please bring back the Saturdays. We all enjoy it. We all love it. I think the feeling that everybody gets out of volunteering to those that are less fortunate, that's what they were really asking for. So we went back to our 2 Saturdays a year and hope to do probably somewhere a total of another 50 patients this year. So
Oh, wow.
yeah, so there's a great need out there, no doubt.
There is, and I think there's so much amazing work that also goes on internationally, but sometimes we forget, or we're just. I've had a lot of surgeons that haven't even been aware of the pressing need within their local community. In the US, COVID has really, really emphasized that need and made it a lot more immediate for patients. But there's such a high need of patients that are uninsured, completely or underinsured, and that their insurance won't cover any portion of cataract surgery, that really need help in their local community. And eyesight, having their eyesight restored, is really just the key for them to get back to a life of independence, and financial stability, being able to secure a job again, etc. I know charitable cataract surgery, just in general, making eye care accessible, to all patients, has been really important to you. When you look back, has there been a moment when, you really became aware of, this need, and wanting to give back and make a difference?
Yeah, it probably was around when I started the program. I started to see patients that came in the office that were desperate. They had been waiting and waiting and waiting to try to find somebody, and just the oh my God, thank you for having this program. We've been looking for a year, and it's clear that these cataracts have been around a long time because they're so advanced when they come in. So yeah, I think I can remember a few patients where they came in with a white cataract and had been trying to find care. Other doctors that wanted to charge them several $1,000s to do their surgery. I had people traveling, from different states, traveling from Arkansas, from Colorado, from California, to come to St. Louis because we had this program that was providing free surgery for patients who are truly in need, that had no other insurance and really no means to pay for it.
That's incredible. I think we see that a lot with Operation Sight patients that are willing to travel whatever distance just to kind of get the
Oh
care
yeah.
because they can't afford it. I'm always inspired when I speak to you, just for the phenomenal volunteerism, but this compassion and commitment that you have to making eye care accessible, which goes a long way for patients, their families and their local communities. It really has a ripple effect of good. So, I wanted to close out by just asking you a simple question. There's many surgeons that are interested in making a difference. And for someone that's maybe not yet, volunteered and registered to volunteer with Operation Sight, what would be your advice for a surgeon that's interested in giving back but hasn't yet made the next step to make that?
So I think it's very easy. I think the Ascaris Foundation makes this incredibly easy. You guys will screen the patients, you'll funnel them to us. And honestly, if you do 1 or 2 cases a year, I mean, the reward you get for doing that is immense. And I think we all went into medicine, at least I hope we all went into medicine to help people. And it's just unfortunate there are people in our country that can't get good care, can't find anybody to do what they need. And vision is such an important part of everybody's life, being able to be a productive citizen in our country. If you can't see, you can't work, you can't drive, there's so many barriers to being a responsible, productive citizen if you cannot see. So, I think it's easy to become a volunteer. You can do as little or as much as you want. You don't have to do 50 cases a year like my program. You could do 1 or 2 cases a year and make a difference in someone's life.
Absolutely. Thank you so much for your time, Dr. Donahoe. I think it's really important noting that there's such a power within the ophthalmology community that you have the skill to really change someone's life. So thank you so much for everything that you do at St. Louis Mission Cataract. It's always a pleasure speaking with you. Thank you for your time today.
Thank you, Jaya. Thank you for having me, and thank you for your continued support. We really appreciate it.
Thanks.
Operation Site volunteers are icons for making cataract care accessible. The need has never been greater, and your participation can make all the difference in a patient in need's life. To get involved, visit ascrsfoundation.org and register as a volunteer, or reach out to me directly at jminhas@ascrs.org. Not able to volunteer but still want to make a difference? Consider making a gift. Every day, Operation Site receives inquiries from patients needing charitable cataract surgery. Visit ascrsfoundation.org/donate to make a gift that can literally change a life. Your generous support helps increase Operation Site's impact both in your hometown and throughout the US.